So this is our favorite range, which is the hyperpigmentation range, not only by us, by all the patients. There are many studies behind this, you will see now, and it's really unique molecule. You cannot compare it to any other molecule. And as I mentioned, it's a patent only for us. Nobody can use it up to 10 years, with this molecule, which is the thiamidol. So let's talk simply about the pigmentation. Pigmentation happens due to overproduction of the melanin, which is the pigment itself. If we stop the melanin production, the pigmentation will improve. Okay? Some ingredients, which is very, very well known before, even by practicing by the doctors, work on blocking the melanin, but also have very strong side effects. And sometimes, mostly also, the medical ingredients, which is work on the melanin products, which is already we know about it, and it's effective. It helps with reducing the pigmentation, but it can worsen something else. And it cannot be safe, for example, in pregnancy. It cannot be used for long duration. It should be for a short duration, and then we have to stop it. Recurrence of the pigmentation might happen once they stop the product. Okay, so for hyperpigmentation, we have to stop the problem. We have to make sure it's not coming back, and we have to make sure also about the safety. Okay, so here comes the patent thiamidol. So how thiamidol works? Basically, thiamidol works on the enzyme which is responsible for the melanin production, which is the tyrosinase enzyme. And by the way, many molecules work on, or assumed by the companies that it blocks the same enzyme, which is the tyrosinase. But when the company is studying these molecules, they used to study it on the mushroom tyrosinase. So when they are conducting these studies, they are using the mushroom, and they are assuming that it's effective in human. Okay? But for the thiamidol, it was the first molecule studied on the human tyrosinase enzyme itself. So we are 100% sure it's suitable and effective for the humans. Because nothing makes sense that what's worked on mushroom will work on human, right? As simple as this. So that's why we say it's the first tyrosinase enzyme inhibitor, the first molecule which is blocking the human tyrosinase enzyme. That's why it's patent and it's a breakthrough. We are the people who discovered this. After many years of research and trying like thousands and thousands of molecules, we found that thiamidol with very minimal doses are blocking the melanin production. And here comes what? The safety margin. The safety of the thiamidol is very high. It's safe in pregnancy and lactation. And this is also studied. And we have studies with this. Okay? There were the latest study or the consensus or the publication which happened. It was the previous year in 2025. It was globally published everywhere and in a journal which is called GEDV. This is a really famous journal for dermatology. They published a consensus how to manage pigmentation from mild to severe pigmentation with the steps. Let's say it's a guidelines, how to manage the hyperpigmentation stages. They found that thiamidol is the only molecule which is, number one, safe and effective as a topical, even as a monotherapy for the mild and to moderate cases. And when the severity increases, they can combine with it other molecules or other procedures that they are doing in the clinic. Okay, this was published in the in Paris last conference, which is EADV. It's really famous conference between all the dermatologists where they socialize and speak about scientific content. So it's like around 10 years of research about this molecule to say that it's effective. So it's medically supported. Okay, and 50,000 molecules were tested. So we are 100% sure that this molecule is the one which is effective. As I mentioned, it's patented also for us, and it's the first active ingredient which works on the human tyrosinase. Usually we tell the patient it can be used for all type of, all shades or all phototypes. The research which was done, it was done globally in all the continents, in Africa, in Europe, in South America, everywhere, even here In UAE, Dr. Hassan Galadari is a very famous dermatologist, a local dermatologist in Dubai. He was part of the study. And and the consensus also in Brazil, everywhere they were part of this study. We can see the results, the effective results of Thiamidol can be seen after 2 weeks of application. And this is really important because people who have hyperpigmentation needs very, very fast results. If they apply, they are not patient. The patient is not patient at all. Really, they need to see visible results. If no visible results, khalas, shift to the other product and so on. Okay, but we need to make sure that they are using, as I mentioned before, they have to use the recommended number of applications to get the fast result. Okay, it's number one, as I mentioned, number one globally molecule, which is suggested by the patients to manage hyperpigmentation. It can be used for all types of pigmentation, for the body, for face, for PIH, as we mentioned before, the post-inflammatory acne, for the folds, for the body, okay, for the eye, around the eye, we have also the eye cream for this. And every product is different than the other. The ingredients is different, I mean, for according to the SKU. So that's it here. We already spoke about the melanin. I will not take you through the process, but we said that the pigmentation, the pigment happens due to the tyrosine enzyme. It comes in the keratinocytes. It produces the melanin. So the shade or the pigmentation comes. The hyperproduction of melanin makes the pigmentation. So what we have to do as a treatment to regulate the melanin production to get good results. If we block it permanently, what might happen? Some other ingredients might do that. Hypopigmentation happens. Here, which comes, the white patches. Some people abuse some pigmentation products, like the hydroquinone, for example. It's one of the very famous molecules for the pigmentation. Clinically, between all doctors, it's a traditional anti-hyperpigmentation, but all of them also know that it's having many severe side effects. That's why you cannot recommend such molecule in the pharmacy, right? And it might cause relapse or it might cause hypopigmentation. So here is the risk. For us, 100% safe. Anybody can use Thiamidol, even the pregnant and lactating lady, for the face and the body. Okay? So here you can see here this is the baseline, for example, somebody having some redness as well, because our products is having a combination for sure, not only Thiamidol besides something for inflammation and so on. So you will find here, for example, some redness, see after 12 weeks, the improvement. Here also, see the pigmentation. It's really visible. This is 12 weeks of use. So to see a real result, they have to continue on the product. They have to be patient. They start seeing improvement after 2 weeks, but they will not go from black to white, right? They will not be like this. It's a process. At the end, it's a process. Once they stop the use of, for example, any product which having Thiamidol, it's not permanently damaging the tyrosinase enzyme. No, it's not doing that. So it's not interfering with the enzyme itself. Many components in the market for pigmentation from many multinational companies as well. What's the difference between ours and other competitors? Not all of them working on the enzyme. The mode of action is the difference. For example, you will find, I don't want to mention names, but some of them, they will tell you that we are capturing the precursors or the precursors of melanin. There are some ingredients, the enzyme take it and produce the melanin. So they are like a goalkeeper trying to catch all the precursors. Is this logically might work? Definitely no. If you block the factory, is much more effective, or trying to catch the precursors is more effective. For sure, stopping the factory is much more easy and much more efficient and much more safe and effective. So this is where you will find the difference. And by the way, in the consensus, there were even, if somebody goes through it, you will see it in the study itself, they compared many molecules. They even didn't consider these, which are the precursor, capturing the precursors. As I mentioned, it's in minimal doses. You will not find the concentration of Thiamidol on the bottle itself. If sometimes patients are very curious, they will tell you, Okay, how many thiamidol inside this if they are very knowledgeable? We don't mention that. It's at the end, it's only our molecule, no other companies. Nobody will say we have higher concentration than you. So we are not mentioning this. But as you see here, in a very minimal doses, it's inhibiting the enzyme. 0.000 something, it's inhibiting the enzyme. So we conducted around 70, more than 70 clinical trials on this. We're conducting all everywhere. We also have 7,000 participants in the studies, which is a high population. We also have many publications about thiamidol worldwide in a very trusted dermatology journals. And it can be safe and works for all phototypes. If somebody from India or somebody from Europe, it will work for all. So let's skip this, it's too much for you. So the ingredients, as I mentioned, all the stages, all the ranges that we have from cleansing step till the sun protection. We have all the steps. We have the treatment, we have the preparation step, and we have the sun protection, okay? We have for the face, for the body, and for the eyes in this range. The active ingredients, it depends according to the SKU itself, the serum or cream or night cream like this. This is our star, which is the dual serum. For sure, patients will come and ask you, do you have this? Because it's really famous between the patients themselves. And it also, most of them likes the texture because it's also hydrating, because it's having hyaluronic acid. So the active ingredients in this range or in this product, for sure, the main one, which is thiamidol in all the range, it's having leucocalcone A. Somebody tell me leucocalcone A effect now. Inflammation, good. And you will find if you go behind the molecules itself, the ingredients, many molecules extracted from licorice in most of the companies. It's really rich. So leucocalcone A, as we mentioned, from licorice, it's anti-inflammatory, and we're having the hyaluronic acid in high molecular weight and low molecular weight for hydration. So what's the difference simply? What's the difference between the high molecular weight and low molecular weight hyaluronic acid? Do you have any idea? What he mentioned, there is an enzyme in our body, which is the hyaluronidase enzyme. This enzyme is responsible to break down the hyaluronic acid. Okay, so if also you have another ingredient with the hyaluronic acid, which blocks this enzyme, it will keep the moisture more and longer for a longer time, because it will preserve what you applied already and what already your body is producing. So this will help have more hydration, which is available also here in some of the SKUs, which are in this range. We have a molecule which is called the inoxabolone. Inoxabolone also extracted from licorice, and also it's having anti-inflammatory effect and inhibit the hyaluronidase enzyme. It's really a key ingredient. So as I mentioned here, the hyaluronic acid, and the inflammation and the pigmentation, the melanin production are already managed. That's why it's a superstar for the people who have pigmentation, rosacea, for example, redness. They need to soothe it down, and hydration. Believe me, if you give them a recommendation one day, for example, and they found this product is really effective and they like it, they will always come back to you specifically. They will search for you. Even if you are not in the shift, they will wait until they find you. So, as we mentioned, we are already scientifically based products. So usually before launching any product, many researches has to be done. And as we mentioned, Germans don't, they are very strict, and they are really sharp. They will not launch anything or put something in the market unless they know that it's really effective. So the results that the patient should expect from using the range itself or the dual serum, it should be visible after 2 weeks of use. As we mentioned, thiamidol starts improving the case after 2 weeks. But just when you are selling to the patient, just don't give a sharp commitment to him. 2 weeks and you will see the magic. No, he will. This is really important, because here you raised his expectations too much. It also depends on the severity of the pigmentation. It might be years of accumulation of melanin. Specifically, for example, the area also of the pigmentation, if in the sensitive area, it's really hard to... So let's go through the ranges. We are having the cleanser. The cleanser is the cleansing step. It's having exfoliating AHA as well. The AHA, which is there, is glycolic acid. And it's having also lactic acid, which is really famous about the brightening. It's having these ingredients. So the AHA, as he mentioned, we have lactic acid, glycolic acid for the exfoliation and skin renewal. So that's why it's brightening effect. It's having very mild surfactant. It's not harsh on the skin, so it's not drying at all. Anybody can use it for a long time. It's my favorite, and it's my personal cleanser. Okay, and the dual serum for treating and stopping the melanin production. So here is the treatment. Okay, so the cleanser is the preparation step, as we mentioned. These are the benefits of the acids. I will just scroll it.
Yeah, let's say that if you miss anything, the presentation. And
yes, I can share it for sure. So here is the improvement, the feedbacks from the patient. 99% find it's really a brightening effect and radiant skin and clear skin after using the cleanser. And there are studies combining the serum with this cleanser. Except some people say, I have already my own cleanser. I will use what I have. Combining these two, it's boosting the efficacy higher and higher for the pigmentation and and shortening the time which they will see the improvement. Okay, so let's skip this. I already spoke about the serum. We are having this is the range. You will see in the pharmacies, mostly not in the medical. You will find it in the retail. This skin perfecting serum. So we have two serums now in this range. What's the difference between them? So this one is intendedly for the instant. It's giving like a boost. You know, you want just tomorrow she is having, or after 1 week, she's a bride or she's having one occasion and she needs something which gives a push. You know, so this serum is the perfect one. So it's just intended for the radiance of the skin. Okay, it comes with a dropper even. It's different texture totally than the dual serum. The dual serum, it's a serum, but it's a little white color, and they might confuse it between the serum and cream. They think it's cream, but it's a serum texture. This one is the treatment of the pigmentation. So that's why this is the start. The application, morning and evening, all the range, morning and evening, except the night cream for sure. Then comes the day cream. We have the day cream. The day cream also, all the range having the Thiamidol, but for example, the day cream having SPF as well, protection from the sun. It's having SPF 30. And the night cream having more hydration. It's having dexpanthenol. So usually in any range, morning, sun protection, night, hydration. Some people, for example, you can work, for example, you have to know the patient, as we mentioned before. You have to know his needs. For example, she's having dry skin a little bit, and she's also having pigmentation. So it's best to give the serum with the night cream. This is the most recommended from our side, because for sure they are using sun protection, so they can use the night and apply the sun protection after that. By the way, we're having sun protection for this range, which is having Thiamidol. So we are fully covered. And a really important information regarding the number of applications required to get a faster result, according to Beiersdorf recommendation. For the face, it's recommended 4 applications per day, total, not from the one product. Pay attention to what I'm saying now. So if they are using, for example, dual serum, and for example, night cream and sun protection, all are collectively counted. Even the eye, it's counted. If he's using the eye cream and the serum itself, it's counted. So for the face total, 4 applications. More than that will not add a benefit. Less than that might delay the results. They will have a results, but they might not get the results after 2 weeks. It might be 3 weeks. It depends also on the depth of the pigmentation itself. For the body, 2 times on. We are having the body lotion available now also in the market and available with you in the pharmacies. Having the Thiamidol, safe in pregnancy. They can use it for all body parts, even the sensitive area, and it's having really pleasant scent. So even they use it as a moisturizer. It's really, really nice. Some people who are having deep pigmentation, specifically, make sure the people who are having pigmentation in the body folds, it's really stubborn due to the friction, the moisture, like the bacteria growth, all this. There are many factors which is delaying the effect. So if you have to ask the patient too much as well to know, since when she's having this problem, she might get it recently after giving birth, for example, or the hormonal change. It's something recent, new for her. It might be for 100 years. You don't know. You should ask her about getting more information before recommending. Some people, it will work for them, the body lotion alone, and some people are using the serum and the body for the sensitive. Even the doctors are prescribing like that. If it's really stubborn, they use the serum And they use after that the lotion as an emollient, but it's having the active ingredient as well. We are having also this one. They say here new, but it's not new at all. It's available in the market and it's preferred by the patients really too much because it's having a cooling applicator. Okay, they even massage the area around the eye with this one. It's having the Thiamidol, which works on the production or the dark circles itself, the puffiness as well. And it's having something called illuminating factors. This is really unique in any eye. It's not available in any eye cream. The illuminating factors are small particles which reflects the light. So it gives the feeling of glow. So they feel, we are working here on the perception of the patient himself. He feels an instant effect. So we are working on his feeling and on the long run effect as well, because we have the Thiamidol. So really they like this one. Sometimes we are recommending them, even sometimes they put it in the fridge and to make it more like massaging, you know, with this one. Application, morning and evening. So the Thiamidol, morning and evening. Okay, except the night cream only at night. Yeah.
How does you also recommending them to like use twice? But first they have to apply the serum and then like 5 minutes.
Yeah, to absorb. This is a really important question. See, I will tell you, no, you are right. But let me just, because you reminded me of something important. The serum, as we mentioned, it's having hyaluronic acid, high and low molecular weight. High molecular weight, what happens, as we mentioned before, it stays on the surface. If we just put it layering too much after, and we are not leaving a little bit minutes to get absorbed, your skin will absorb the products. If you apply something else and start rubbing, for example, the sun protection, it will shed. They will feel, you might receive this complaint about the product. This means they are using it wrong, not the product itself. So it's having really a high molecular weight hyaluronic acid staying on the surface. They apply and then suddenly she wants to go to work. So she's just layering very fast and rubbing. So it's shedding, it's falling. The sunscreen is shedding. Yes, so this is important advice. You have to tell her, when even not only for, if you apply serum, so you have to apply it, leave it 1 minute until you even dress up, and then put whatever you put, moisturizer, sun protection, makeup, whatever you want. It's really important. Yes, you are correct. Usually, what's the steps that you are using? You can. Thiamidol, even pigment. Eucerin, even pigment. I mean, I'm just reminding you of the name of the product. Because of what? Vitiligo. It will not go with vitiligo at all. I said it's reversible. You remember when I said it's blocking tyrosinase, but if I stop Thiamidol, I didn't damage the enzyme. I didn't like the hydroquinone. The hydroquinone damage, it's killing the enzyme. This is the mode of action. If we go deeper, you research deeper about the mode of action of hydroquinone, yes, it's working on the tyrosinase enzyme, but it's damaging it's killing the enzyme. It's removing the enzyme. That's why what happens, the hypopigmentation might happen. But here, it will never happen. Because we are only blocking, but if I remove the molecule, it functions normally. It's not interfering with its normal function. That's why the safety margin of Thiamidol is very high, and that's why they even recommend it to pregnant and lactating. Usually, even the companies don't invest too much in this, and these people are very, very, it's sensitive to give or recommend any product. But here, you can confidently do that because we have the researches, which is supporting that. I'm done. So now, you know already about the eye. Only the body I need you to see. The body lotion comes in 250 ml. I'm trying to find this is the one. So also the application morning and evening, as we mentioned, the composition is the same as the others. The 60% of, it's increasing the skin evenness by 60%, and you will see the results after starting from 2 weeks. Better if too much pigmentation or for longer duration, use the serum, then the lotion. That's it. Now they know already about the full range. If you want to ask any questions, let me know. By the way, we have also the hand cream. Some people, after going to the summer vacation, going to the beach, they are having pigmentation in their hand. This one will work for them magical as well. No, it's available. Yeah, it's available in the system. If you require it, you can request it. All the codes, by the way, I have all the codes. If you want me to share the sheet, I have.
But instead of using the one, I'm using the body lotion.
You can. Some people like it to use خلاص one only. Some people need something because this is a lotion at the end. You know, the texture of the lotion is very light, not the cream. And the size for sure it's 50 ml only. And it's cream, it's not lotion. So it's also hydrating and it's a little bit, it will stay more than the lotion. You know, the lotion is more for spread and for the larger areas. So it depends. If you just, it's according to the cost. If you want to buy only one item, you can give the lotion for the full body. If they want something also moisturizing, they can get the hand treating and moisturizing. Available. All the range is available. See, the even pigment is a star, product with us, so it's available everywhere. So whenever you want, he can share with you the codes and yes, thank you so much. Really, I'm really happy.